The coronavirus disease is a virus that took the world unaware, and a lot of Africans, particularly Cameroonians, are still facing the difficulties to accept the realities on the ground. As a result, to prevent the spread of the virus, the World Health Organization had put measures in place. The government of Cameroon had put simple measures to respect it in order to avoid contracting the virus. And as a result of that, the media, organizations, and the government as well has been carrying out a lot of sensitization in order to create an awareness in the minds of people. And since we are talking about the coronavirus in tonight's edition, ladies and gentlemen, good evening and thank you very much for joining us. And talking about this, we are having as guests in the house an artist and someone who has been face to face with the pandemic and someone who has gone through the challenges of being affected and of course getting cured by the virus. And I'm talking of Mufo Christiantus, popularly known as Asamo. He is an artist, and as a way to reinforce the sensitization campaign of the coronavirus, he came out with a song known as Dr. Koro Koro. He will be accompanied this evening by Mangevenashu, so stay put, stay tuned, and get informed more about this virus. Good evening to you, Asamo, and thank you very much for being our guest tonight.
Good evening, Vanessa. I'm very happy to be here, and I appreciate the fact that you give me the opportunity to be on your show this evening.
It's our pleasure. Mangevenashu, good evening and welcome.
Good evening, Vanessa. Good evening to our viewers. It is another opportunity for us to share with them.
Another opportunity for us to share with you. Stay tuned. Let us take the first part of the show, that is the question and answer. In the first question, can Africans have any justification for their lack of belief in the existence of COVID-19? Asamo will begin with you, yes or no?
I think the answer is yes.
You think it's yes. Mangevenashu?
No, Vanessa.
They do not have any justification, no. And can something be done to intensify the awareness of the virus in Africa as a whole?
Yeah, something has to be done.
Something, Mangevenashu?
Yes.
Something can be done. That's it. Let us take the second part, the debate. Once more, ladies and gentlemen, you are welcome. In our first question, can Africans have any justification for the lack of belief in the existence of COVID-19? Asamo, you think that yes, there is a justification why they find it so difficult to accept the fact that there is coronavirus in Africa?
Yes, Africans find it difficult to believe because, first of all, as we all know, Africans have been deceived in many ways in the past, and when you have been deceived, cheated, and suppressed, you have the tendency of always doubting whatever the oppressor, or the people who have always deceived you happen to tell you, and I think that is why we keep doubting.
Okay, they keep doubting, but then seeing the fact that we've heard of the number of infected cases, the number of deaths, and the number of recoveries, and looking all the budget in which most African countries have put in place to tackle the virus, is that not enough to convince Africans that it exists? Because a lot of them say they want to see the proof of it. They have not seen anybody.
No, here I'm sitting here as someone who was affected. The point is, we doubt. Doubting doesn't mean that it does not exist. The fact that we doubt doesn't mean that the coronavirus does not exist. It exists. And then secondly, when you see the number of people who get infected in Africa or who die in Africa, it becomes difficult to really think that it exists. But the truth is, from my personal perspective, I have the feeling that maybe because we have a very young population, in Africa we have a very young population, that is why the effect is not very high. And secondly, I've been imagining, after experiencing what happened in Europe, or what is happening in Europe and many other countries like Brazil, what happened in China, these are developed countries. If people die, so many people die because of a pandemic, we cannot think that it's a lie. But why don't people die in Africa like in China or Brazil, for example? It is because, first of all, we have a very young population, and secondly, like they said before at the beginning of the pandemic, that the weather has an impact. So maybe our weather, our population, and I also have the personal feeling that maybe because we don't take the precautions, we don't respect the precautions or the protective measures, we keep interacting without any fear. I have the impression that maybe so many people have been infected, and without knowing, they got the immunity, and that is why so many people are not dying.
All right, because they talk of being asymptomatic, because we do not have that testing capacity, like mass testing capacity. You will hear of several African countries that must have done mass testing to actually come out with an effective number of infected persons of the coronavirus.
Yeah, the problem is it is not only testing. You can be infected and you don't even know, because not everybody falls seriously sick after being infected. If you are infected and you don't know, after which you have immunity, it means you can interact with every other person around, even infect others who equally do not get sick, and at the end, nothing is happening. But then the virus is there.
The virus is there. Just to remind our televiewers that Asamo is one of the victims of the coronavirus pandemic. He contracted it, and today he is well. So, could you tell us a little bit about your experience when you contracted the virus?
It was not very easy. Actually, it is my wife who got infected because she is a nurse. She got it from her job site, and she was tested positive, which means all of us, my entire family, my wife and children, were supposed to be quarantined, which means you don't even leave your house. You don't have the right to leave your house. The first thought was that we were going to die, because at that moment it was in April, very early at the beginning of the pandemic. So the first thing you think is, okay, it means we are going to die. But I'm someone, I don't know, sometimes I do things like they say, artists are creative people, we do things just the way we think. When it occurred to me that we were infected, the first thing I did is, okay, if I have to die, I will die. And if I don't have to die, let me help sensitize the public, because I decided to do a Facebook live show during this period. Each day I went live informing the people how we were feeling. All right,
when you still had the virus?
Yes, when we just had it. I did all the 16 days I was in quarantine. I kept giving a report of how we were feeling and what was happening next, and how the government was dealing with us, and whatever, how the quarantine, the feeling of the quarantine, all the like. I did it on Facebook throughout the whole of that period. All right. And it is even after that that I decided to compose a song on that.
All right.
So my goal was actually to sensitize the public, let people know that it exists, and to take the precautions.
And to take the precautions as well. Thank you very much for your contribution. You stay with us because the debate just started. Mangevena Shoes, why we get your point of view? You rather think that Africans have a reason to justify why they do not believe that coronavirus do exist?
Yeah, why they don't believe that coronavirus exists? That's why I said they don't have a reason, because coronavirus, like they told us, was a pandemic like every other disease, every other virus that has been attacking mankind down history. And when you listen to reports that came from other countries, it started from China, France, Italy, other European countries, people were dying. Actually, you know, when they say we have 300, 800 people dying within 24 hours, it was as if this thing was not, you know, is this real? And all of a sudden, by February, Cameroon, March. Cameroon,
mid-March.
Yeah, it was announced that the virus is already in Cameroon, and life was as if it was coming to a standstill, because it was, we never knew whether it was airborne, waterborne, and because the simple fact was you could just contact it anywhere. I remember schools were closed, churches were closed. For the first time in my life to hear, you know, that churches were closed. I think this was the only year that people celebrated Easter in their houses. It was as if the world is coming to an end. Remember, one of my neighbors was saying that this is a clear sign of the end of the world. And actually, if you were not strong enough, you could find yourself believing all this kind of myth. And the worst thing was they were preaching coronavirus, but nobody ever saw a patient. They were preaching the numbers that were growing in Cameroon by the day, like minutes were going. Nobody ever saw a patient. News came up that the governor of Douala was infected, and after some time, he was okay.
News came out when he had recovered.
Yes. So nobody was, I am happy to see, this is my first patient to see live, to tell me that I was infected, I am cured. So I think that Cameroonians do not have a reason to say that, to doubt the existence of this pandemic, because from other countries, the video footages that we had, the images that we had, those were clear justifications. Scientifically speaking, they could detect, they could prove the existence of this virus as a normal virus, that was created in a laboratory. Like any other viruses that we've had, Ebola virus we've had, the HIV virus we've had. So there was no reason to doubt. What made Cameroonians to doubt the more was the strategy in which it was, the evolution that happened in Cameroon. So fast, Cameroon started, growing in numbers. At one point, the numbers ceased. Deaths started growing. At one point, schools were closed, churches were closed. But what happened? Off licenses were opened. Bars were opened. The markets never closed in Cameroon. And then when you put this together, you tend to ask yourself, does this coronavirus exist? That's where at one point you could see why Cameroonians were doubting that, is this thing really real? Is it not another scam? They could close
churches, they could close
churches, schools, and some business places cut down their workforce, but then markets were operational. Beer parlors, nightclubs were operational. At one point they talked about traveling agencies, but after 2 months, they came back. So Cameroonians were seeing it like, is this not another government scam? To scam Cameroonians that there is something like coronavirus, but then from every point, scientific point,
even some of the isolation centers never had patients, never welcomed some patients.
Up to today that we are talking about, even dismantling some that were mounted, they never welcomed even one patient. But we have been climbing up to 18,000 cases, and so I think that the whole issue is the fact that we do not have the same experience or the same evolution of the pandemic, of the virus, like it did in Western countries, is not a proof to doubt the existence. I was reading a paper this morning where they are talking of, possibilities of a second wave of contamination in the United Kingdom. They have started talking about new modes of, of prevention, where no more than 6 people are allowed in a group. Large groups are outlawed. So I think that the fact that we have not seen the other side of the pandemic, of the virus in Africa, in Cameroon, is no proof, no justification to refuse the fact that it does exist. It does. It exists. Scientifically speaking, you can test it and you see that it does exist. But all I think is that we need to, at times, the fact that the sun is not shining, you don't need to doubt that the sun is there. The sun is there, although it is not shining.
So
although we are not facing the impact of this pandemic in Africa, in Cameroon, as other countries are doing, it is not the time that we should doubt.
So does that explain why they find it so difficult to respect these barrier measures?
That is why when you ask somebody,
wearing a face mask,
when you ask somebody to wear,
it's no longer practicable in Cameroon.
Of course, it has vanished. When you ask somebody to wear a face mask and drink beer, how would they do? Why would you wear a face mask?
Well, you even move the face masks now on the way.
You seem odd. Yes, it's not like So I think that the way the government handled the issue in Cameroon pushed Cameroonians to doubt the existence. It pushed Cameroonians to doubt the existence, but then the poor management of the pandemic, of the crisis, does not mean that it does not exist. That's what I wanted to insist on. It does exist, because people cannot. That's why I said this is my first patient or victim. Somebody cannot say I was infected, I was healed, and then I doubt. Well, at the time, people took ill. I like what yes, what Samofo said somewhere. He said they might have been infected, but they did not know that they were infected. I remember at that time, around April, May, practically everybody was like down, and you are suffering from either cough.
No, we all went through that period.
Of course, of course. And that is why some people even believe that that might have been their own phase of coronavirus, but then it did not manifest itself like it did in other countries. So to doubt that it doesn't exist is to play, and maybe play with our health. Anything happens, you cannot come back, because when you hear of 800 people dying a day, those people will never come back. Whether coronavirus existed in their country or not, they have died. So one thing we should do is, like one philosopher says, believe that the virus exists. If at the end of the crisis there are justification that it did not exist, you would have lost nothing. Rather than doubting that it does exist, and then you get yourself contaminated, and when you die, and at the end they prove that it existed, you were already dead, you cannot be revived.
You cannot be revived.
Yes, Vanessa.
Thank you very much, Mange Venatius, for that clarification as well. So, Asamo, if what are some of those things that can be done to intensify the awareness? If you say that something can be done, what can be done to tell Cameroonians that you need to respect these barrier measures because there is coronavirus?
And to go ahead, I would like to really
add
something to his idea. What he said is just what I've been saying all the time. That you either believe that there's coronavirus, and if at the end there was no coronavirus at all, then you are safe. But if you don't believe and it happens to come, like it happened in many other countries, it means you die. And when you die, you are gone. Yeah, there are many measures that we could take to continue to sensitize. First of all, like the song I did, and many other songs that other artists have done. If our government could try to promote those songs, like myself, I've never come to Cameroon to do promotion, but because I thought that I did a song that was really to help educate and sensitize the public, I took up the time and invested in it to come and do my own part of the sensitization. So that's what I'm going around doing, so that everybody should follow the message, take all the precautions possible. If the government could help us to promote the songs and every other thing, because when we open the bars and allow everybody to go out, it means even the government doesn't believe in the coronavirus pandemic. And then
the bars were open with some preconditions, meaning that you should put on your face masks, you should respect social distancing, and you should keep on washing your hands regularly. But then it's not what is being respected, because they open bars with the clause.
Who's supposed to enforce the laws? If you just put restrictions and then nobody cares where the restrictions are respected, how do you do? Because I came with a lot of masks, and when I tried to offer some to people, they told me it was like I brought the coronavirus to them.
Of course.
So, which is something very strange.
Okay, all right. They felt that you have come to contaminate them. So
can I add something, please?
You can go ahead.
One thing I would like to say is, apart from the fact that we should keep social distance, we realize that all the precautions that we are supposed to take are very good for our general health and hygiene, because if you wash your hands regularly, washing your hands regularly, doing whatever
you save yourself from a lot of germs.
Even wearing the mask to protect, save us from the ordinary flu. So you see, it can only help us. Apart from social distancing, all the measures are very good for our general health.
That's why one time we received a doctor here. He said generally the washing of hands is something that we should cultivate as a habit. It should not just because maybe you want to eat before you wash your hands. No, but at every intervals, do wash your hands, because it's for our own general good. Mange Venatius, if things are supposed to be done, what are some of those things to intensify the awareness of the virus?
Vanessa, is just to let Cameroonians believe that it does exist. Like Mr. Mofo was saying, you see what the government did was just putting up laws, and then cancelling the laws, from the practical aspect of that law. You cannot put a law that is not practicable, that cannot be achieved. You cannot ask somebody to jump and stop and touch the sky. You cannot do it. You put that as a law, you know that such a law would not and would never be respected. Well, you cannot tell people to wear face mask and then drink. The process of removing a face mask and drinking at all the time, how would it look like? You cannot ask somebody to go and sit in an off-license. In an off-license, what do we drink? Not water. We drink alcohol. And once you drink alcoholic, then you end up being tipsy. And once you are tipsy, you don't have full control of your faculties. How much of you think of washing hands? How much do you think of? And in off-license, can we practice social distancing? How large will such an off-license be?
You can do it.
It depends on how large will the off-license.
It can be done, Mange Venatius.
So, Vanessa,
in off-licenses, if the space it takes 10 people,
yes,
then you should accommodate 5 persons.
All right. Off-licenses are commercial centers which are not being subsidized by the government. and every operator of any commercial center is profit oriented. I will not see the space of my office that can take 10-20 people, and then I respect by taking 10 people. Who pays the bill? Who pays the electricity? And then end up not selling my drinks. Who takes the responsibility? I think that, like they did in some other countries, it's not that the government could not do it. It's not that the government could not do it. In some countries, it was practically prohibited. I'm talking of a country like Britain that is talking of, second possibility of launching other measures, and they are prohibiting a group of more than 6 people. India was grouped from 2 people, it was prohibited. So it was one man to himself, and you remain in your family. It's not as if we cannot do it in Africa, or do it in Cameroon. In Cameroon, you know what the government said? From 50 upward, it was prohibited. As if coronavirus can only spread from 51 and above. If they are 49, can it not spread? And you tell people how to respect it. Now, we spoke about wearing of face mask. In some countries, it was obligatory. If you don't have a face mask, you remain in your house.
Or you cannot
leave. Or you are being fined, or you are being arrested. It was well implemented in some other countries. But in Cameroon, it was as lax as it has always been. And I remember the last time that the Prime Minister spoke about it, he said laws wearing of face mask is supposed to be obligatory in Cameroon. And one thing that government officials does is they make our officials, our leaders, to lie without knowing. Because when you insist, you remember what the president said, we are doing everything to make sure that barrier measures are respected. Vanessa, somebody said the words of the president are supposed to be secret. And when the president said this word, when he uses these words, every other person responsible for the implementation of those words must make sure that they are respected. If they don't respect, the simple logic is that the president lied. And when you say the president lied, it sounds like a blasphemy. Yes, because the president is not supposed to lie. The president, the power of the president is his word. Remember the famous promise made to the would-be African nation competition that was to take place in Cameroon, which means the head of state lied. Because people could not follow up the project to make sure that the competition takes place in Cameroon. So I think that it's high time that our officials should respect, the words, because once the authority, they depend on those on the subordinates. If the Prime Minister says the wearing of face mask will be obligatory in Cameroon, he is the head of government, and up to now,
so measures were supposed to be put in place to ensure
he actually said the forces of law and order would be used to make sure that they implement them. Those very forces of law and order do not even have face mask. You see a few who may happen to wear it, perhaps when you are entering an office. Out of that, it doesn't exist. It's as if face masks only exist at official levels. When you see the government ministers, they wear face masks. They are the people wearing face masks. And you know my interpretation? They are the people afraid to be contaminated. They don't care about the other. Because I should not come out in public when you are not wearing a face mask and I'm an official. You should follow my example. Else I'm preaching on the desert. So I think that our officials should need to insist on, in as much as they are wearing it, they should sensitize it. Now sensitization should also continue. We seem to talk and the action, nothing is done. Let us take the sense, like I was saying, when the coronavirus was announced in Cameroon on around March the 5th or something like that, the fear was so intense in everybody. Everybody bought a face mask.
Hand sanitizers.
Everybody was moving with hand sanitizers. All structures had water standing by, hand sanitizers. You see, even the fake ones existed. People were even washing their hands with all sorts of things. Now they have vanished. So I think that we should come back to those early days. It could spare us from coming back to what these Western countries are going. A second wave
of infection.
Correct, because they are going back into it. They were talking about France and other countries. They have started seeing again an increase in the number of infections, an increase in the number of cases of death. So I think that we should go back to such cases and try to resensitize, if it does exist, our communities to respect those barrier measures.
All right, Mangavena shows, and to Cameroonians as individuals, what is the message that you could pass across?
Vanessa, I've always insisted on saying that there is nothing like government. Government is you and I, because I can die, you can die, and the government cannot die. So if I take it as a personal commitment to make sure that I don't look at what the government would be doing, I would assume that coronavirus exists. I'm not assuming. I will believe that coronavirus exists and then carry out the preventive measures at a personal level.
At a personal level.
Charity begins at home. At a personal level, the second Cameroonian starts that at a personal level, the third Cameroonian does that at the personal level. Very soon, our community will do it at the personal level, and it will take the whole country. I think we would be able to, come back to say that we are defending, the spread, containing
the coronavirus pandemic.
I hope that we'll arrive at such a position to say that
we'll get there
completely defeated coronavirus.
Thank you very much, Mange Venashus. I will turn to Asamo. So, what is the message you are passing across in this song, Dr. Kurukuru?
It has a lot of information. I first of all start by telling the people how we are feeling today. Like, we go up, we go left, we go right. Everybody's talking about coronavirus. And then and in the song I'm asking the virus why the virus is killing my people, my sister, my brother, and my relatives. And then I'm trying to give all the preventive measures, washing of hands, masks, and all the like. I think it carries all the information. And at the end, I still thank God that we finally conquer the virus, because I believe that no matter what happens, there will be a time when all of us will be happy that we finally conquered the virus, because I have faith that I believe that we are going to conquer the virus no matter what happens.
Anyway, thank you very much for carrying out your own sensitization, because this is sensitization like doing a broadcast about the coronavirus pandemic. And thank you also for accepting our invitation to actually encourage our public to respect the various barrier measures. It has been a pleasure having you.
I should be thanking you for inviting me.
Thank you. Also, Mange Venashus, thank you for your contribution. Hope to have you tomorrow.
We will be there, Vanessa.
We will be there, ladies and gentlemen. Thank you very much for your kind and keen attention. No, the coronavirus is still in Cameroon, in Africa, and the entire world, and the only thing you could do is to respect the various barrier measures. It has been a pleasure having you. See you tomorrow, God willing. Do have a blessed night in the company of programs on Dbs Television.